Hello, this is Dr. DeShavo. We are back and we're jumping way ahead to chapter 13 because there's a lot of correlations to cells and skin. So I thought this would be a nice combination to put in week 1 for you. So chapter 13, integumentary function. An integumentary, as you may remember, is a fancy schmancy word for skin. We're going to be looking at the skin. And the skin tells so much about a patient. And as practitioners, knowing about the skin and looking at people's skin can save their lives. I had a patient who years ago, I noticed something on her skin and told her, and it was indeed melanoma. Then they removed it, and she's doing great. So skin is a great thing to know the basics about. And with that being said, let's get into the basic structure of the skin. The skin is important because it helps to provide a really good layer of protection to our environment. It keeps bacteria and viruses out of our bloodstream. It's an actual physical barrier, which is a good thing. It helps to keep fluids in. That's an important concept. If you had a patient or have a patient who has extensive burns, they will have difficulty with their fluid levels because they actually lose a lot of fluid through those burns. And you might remember the rule of 9s. I'm going to look for a picture for you about burns, so you'll have that with you. It also helps to regulate temperature, and it senses environmental changes. If you've got a big fat mosquito on your shoulder, you want to have a good idea it's there to get rid of it so it doesn't bite you and cause an itch, but more importantly, cause an infection. So the skin is a really great barrier to protect us. It actually is several cells thick. I'm going to show you a picture of that in a couple of slides. And those cells provide that nice barrier. But we also have layers of cells on the inside of the mouth, on the lining of the intestines, all the way down through the GI system, which provides a barrier as well. So that's one of our first lines of immune defense, is having those layers of cells to protect us from the environmental pathogens that we encounter every day. Now, the integumentary system includes skin, nails, hair, mucous membranes. The mucous membranes are the membranes I just mentioned inside the mouth all along the GI tract. It's the moist membranes that are essentially exposed to the external environment because from your mouth to the anus, it is one large tube that is open to the external environment, and those mucous membranes along the GI tube provide a huge amount of immunological function. It's pretty cool. We have glands in the integumentary system as well, sweat glands, oil glands, mucus glands, some serous glands which secrete a more watery fluid than mucus glands. These all provide good surface protection for our body. When we look at the skin, we have the different layers. The hypodermis is that inner fat, and we know that from hypodermic needles. The dermis, I always say the dermis has got it going on because it has everything. It has glands, it has blood vessels, it has nerves. There's some nerves in the bottom of the epidermis, but don't worry about that for this class. So if we look at the dermis, it's in the middle between the hypodermis and the top layer of the epidermis. And it stores many of the structures. I have a picture in the next slide. Stores many of the structures that are important for the functioning of the skin. Now, the epidermis is important. It's got what's called stratified squamous epithelium. And stratified squamous epithelium is a multiple layer cell. You can see them. They're stacked on each other. And they almost look like eggs. I tell my anatomy and physiology students, if you were to take a large beaker and put 100 eggs in it, that's exactly what stratified squamous layering of cells looks like on the outer layer of our skin. And I'll show you in the next picture that helps to provide protection. Now, we also have melanin, and melanin is a pigment that protects our skin from UV rays, and it also gives a coloration to the freckles in our skin. It's what we release more of if we're out in the sun. It's what we have less of if we're very pale skin. Here's a nice picture of this skin. So what we've done here is this would be the top surface of the skin that you would be able to touch. And this would be the bottom layer. They don't really show you the hypodermis. That's where fat is. And fat has a yellowish appearance and looks like soap bubbles. They would be down there at the bottom of this arrow right here. So that hypodermis has fat, and it kind of helps to anchor the skin down. It provides warmth. Having a little bit of fat in that hypodermic layer provides some warmth and some cushioning. So when we're sitting, it gives us a little cushion in our tushy. At the top, where you see this purple, is the stratified squamous cells of the epidermis. You can see better over here in the drawing. They look like all those smushed eggs that I talked about, layered on top of each other. That way, these top layers, which actually are keratinized, they get hard and they actually lose their nucleus, so they form a nice waterproof layer on the top. Those top layers will actually slough off, and then the bottom layers will push up, and we keep regenerating that skin. Now, you can see this blown up. Here's the dermis. So you can see it over here. It's in the middle, but over here you can see all the things in it. It's where we have hair follicles, sweat glands, muscles that help to pull the hair up, the erector pili, they're called. Those pop up when we have goosebumps too. Blood vessels. This is where the blood vessels are that help to cool the body. So if you're really, really warm, we'll actually open up those blood vessels and emit some of that heat off the skin with sweat and get rid of some of the heat in the body. Nerves are there. And there's also collagen fibers. This is where we have the collagen fibers that provide the resiliency of our skin. And those collagen fibers, as we get older, wear down. So unfortunately, we get wrinkles and saggy skin. That's where it all happens. So you can see the dermis is where all those functions happen. Not that the epidermis and the hypodermis are less important. They're both very important. But the dermis is where we have a lot of the functional attributes of the skin. Excuse me. Here's a close-up of the epidermis. You don't need to remember these strata. Okay, there's 5 strata in what are called thick skin. There's 4 in thin skin. And what these strata are, what I want you to know is you have cells at the bottom in this germinativum, that reproduce, and they push up and up and up, and eventually they'll actually lose their nucleus, and they go into these top layers, the stratum corneum and lucidum, and they are basically little fat and water-filled bags that provide a protective layer to the top of the skin, and it also helps to waterproof our skin. So we can absorb through the skin, but we don't absorb a ton through the skin. Okay, so those layers are basically different forms of these epidermal cells that start at the bottom, excuse me, and push their way up to the top to provide that nice protection. Now, getting into integumentary conditions, there's a ton. When I first opened, I got these PowerPoints from the book, and I'm following them right from the book, so I think that's really helpful to repeat things like that. Oh my gosh, I think there was 130 PowerPoints. So I really pared it down. I'm not giving you a lot of the diagnostic procedures and the treatments because you'll be getting that in your classes. You have in the book as well. So once again, we'll focus on the notes when it comes to the exam because like I said, I did pare it down. I think whoever wrote this book is probably a specialist in skin. Okay, so I didn't include all the conditions. I didn't include all the diagnoses and treatments. I kept it down to what we have in this PowerPoint presentation. Okay, so integumentary conditions. That vascular birthmarks. These are basically different colors for, excuse me, different causes. So hemangiomas, I'm sure you're all familiar with. You could get hemangiomas or dilated blood vessels on the skin. You can also have them in your body. You can get them in the liver, hemangiomas, and I actually know somebody who hemangioma was mistaken as cancer in their liver. So you want to make sure that you follow up with patients, with that. And they would have to have a PET scan to truly know what it was. Thank God it was hemangioma. Now, port wine stains are just discolorations on the skin that look like wine was spilled on it. Benign, doesn't cause any problems whatsoever, and you're probably familiar with these. Now, pigmented birthmarks, as opposed, so these are going to have different levels of melanin in them, as opposed to different amounts of, blood vessels coming to the surface of the skin or causing coloration. So this is pigment from melanin, and these are clusters of pigment cells, including moles. And watch for changes. I am a melanoma survivor, people, and I am younger than I should be for getting melanoma. And I watched this mole grow on my hip for a year before I finally got it removed. Get them removed if you think it's changed. Please. It can spread so easily, and it's so aggressive if you don't take care of it. I am good to go. I am cancer-free, thank God. But I am a big proponent of watching those moles and getting checked if you have any issues. Cafe au lait spots. Very common. They just look like coffee with some milk in them. Mostly are benign. My kids have several of these. Interestingly enough, they have matching ones in their left armpit, more like the tricep area. But if you have multiple of them, of course, we know already from neurofibromatosis that could be a sign of that, but you would have multiple of them and probably other issues as well. Mongolian spots are just flat bluish-gray patches often found on the lower back. Okay, so now we're going to practice these vascular and pigmented birthmarks. I'm going to pull up a picture and want you to take your best guess. You could pause it if you need to. Otherwise, I'm just going to reveal the answer if you think you know what it is. Dun, dun, dun. Hemangioma. That was probably a pretty easy one, and this is probably something you deal with quite regularly, and we know those are benign. Next one. The answer is, you got it, Mongolian spot. Everybody just shouted this one out, didn't they? Port wine stain. That's right, because it has that wine appearance. We just went to the wineries this past weekend, and many of the wines have this color to it. Just saying. Last but not least, once again, very simple and straightforward, cafe au lait. Okay, good. Practice those over and over. Get them into your head. Remember what they look like. Now, moving on to inflammatory integumentary disorders. ITIS is inflammation when something ends with itis. That should sound familiar. You've probably seen a lot of itises in your nursing careers. So let's talk about two types of dermatitis. So contact dermatitis. Yay, something makes sense. You've come in touch with something that has triggered a response, either due to, something that's noxious or an irritant or something you're allergic to. I just went for allergen testing this past year, and I'm allergic to every type of grass. Every time I would go out to garden, I would think that I was starting to get poison ivy, and then it would go away because I would get a rash in my arms. I'm just allergic to everything. So I would get just a very brief contact dermatitis. You get inflammation. You could, mine was very minimal. It got red, maybe a little hivey, and then it would go away. Response similar to a burn. You get redness, swelling, pain. You can go all the way up to blisters if it's a really intense response. Now, atopic dermatitis, also called eczema, is that chronic inflammatory condition. It could be an allergy. It could be an immune system response. It's kind of an immunoglobulin E response where your body has an overreaction to some sort of allergen, and you get those patches, those red to brown skin patches. It can have cracked, scaly skin. It can be on face, scalp, hands, feet. Usually in older people, they get it at knees and elbows. And we're going to practice dermatitis after the rest of the inflammatory conditions. Urticaria or hives. Oh my gosh, I had a hive response once. in chiropractic school. I went to take my really quick story. This is off track, but I took my biochem final and I needed 16, I think it was out of 72 questions to pass this stinking final. And I opened it and I did not know if I had one correct, and I completely broke out in hives. And it was just this immense stress response. I started scratching. I looked down, I was covered in hives. Immense stress response where you release histamine, and histamine comes from cells in the body that actually open up blood vessels. It's the same response as to an allergen that we see if somebody has some sort of superficial bee sting or some sort of allergy response. Histamine is actually released from what are called mast cells. We'll go over that in blood vessels. Opens up all the blood vessels either in that area, or if you're having a systemic response, it'll open the blood vessels everywhere. Like I had that stress response during my biochem. Oh, it makes me nauseous to think about it. Biochem final. So you open up your blood vessels. That'll bring more blood to the surface of the skin, but you can also get kind of red patches, but you could get bumps as well, as the body responds to all this outflux of inflammatory responses to the surface of the skin. Okay, you could have itching with it. It's usually self-limiting unless it's really, really bad. This is something I want to plant in your head, and maybe you understand this concept, maybe you don't. If you have a bad allergic reaction where you release histamine on a systemic level and it opens all your blood vessels, you'll have a decrease in systemic blood pressure because all the blood moves out to the surface of the skin or close to the surface of the skin. So you can actually have a decrease in systemic blood pressure, which is what causes people to pass out because they don't have enough blood to pump up to the brain to keep the brain functioning. So just as a little sidebar, when you have those allergic responses, you can have that happen as well. I hope you don't get hives for my exams. I wish that for you. Psoriasis is a chronic inflammatory condition where the cells proliferate or reproduce too much. They'll actually turn over in 3 to 4 days, opposed to the normal several weeks. Remember, I showed you those layers of cells in the epidermis, or that top layer. It usually takes weeks for those cells to push from the bottom to the top. People with psoriasis, it happens over 3 to 4 days, and it moves up quickly. So the cells build up, and you kind of get that patchy, scaly presentation, which I'll show you in the next slide. Specific cause is unknown. Can be environmental, too much alcohol, genetic. One thought is it might be autoimmune. T cells, which are lymph cells, we'll learn about those in the future. Just think of them as immune cells, actually attack the skin. And substances are released in the skin, which increase the production of those top layer of skin cells. I know you don't know what keratinocytes are. That's what maybe you do remember it from A&P. You don't need to remember that. You need to remember that it'll keep increasing the production of those skin cells on the top, and they'll get that patchy appearance for psoriasis. Now, people who have psoriasis can also have arthritis, and this can cause a lot of damage in their joints. One of the authors I'm reading right now has psoriatic arthritis, and she's actually had knees replaced, one elbow, and she's working on her 4th. So this is no joke. This can progress and cause a lot of problems. There's normal skin on the left. You can see the epidermal layer at the top, and the one on the right represents psoriasis. Excuse me. They have inflamed skin, the overproduction of the skin. You can actually get that plaquing and then white patchy scales on top of that. And I'll show you a picture in. Let's practice. Let's look at a few of these and practice what we think they are. Once again, some of them are kind of overlapping a little bit, so do the best that you can. Once again, pause if you need more time. Otherwise, I'm going to have you take a guess. And the answer is contact dermatitis. Has that appearance as if there was a slight burn. I know this one's might be a little crossover with the others. I wouldn't put these on and ask you to differentiate them, though. I would ask you questions about what is in the definitions of them. What do we think this one is? Dun, dun, dun. Psoriasis. First of all, it's in an E. I'm sorry. That'd be an elbow, Bob. Sorry, I do teach anatomy physiology. Elbow. It's got that patchy white appearance. All right, what do we think? And yes, I covered this up because once again, it seems like whenever I'm studying and working on this, either my kids walk over or I'm in a public place and they can see what I'm doing. And this one, urticaria or hives. I've seen it present more as bumps. This is the picture from your book, but this is going to have that, patchy red presentation that we'll see from the dilation of those superficial blood vessels. What do we think this one is? I think the cracks are the key to this one, right? Atopic dermatitis, okay? And the skin kind of gets cracked. That's got to be so uncomfortable. Okay. Infectious integumentary disorders, I'm going to pick up on in the next slide. Let me know if you have any questions, and I will see you in part 2.